Hello everyone. Today I'm dealing with the next mineral for you. The next mineral is calcium. You all know calcium is very important for us. So let's start the mineral calcium. First, we all know the calcium is the most abundant among all the minerals in the body. Means in our body different type of minerals are present. Out of these all, calcium is present in a higher amount. It is present in abundant when compared to the other minerals. Okay, the total content of calcium in adult is about 1 to 1.5 kg, and 99% of its use or it is present in bones and teeth, and only small proportion like 1% of the total calcium is found outside the skeleton tissue. Which perform wide varieties of function. Okay, calcium, it is most abundant mineral in our body. Total content of calcium in an adult is 1 to 1.5 kg. 99% it is present in bones and teeth, and 1% it is found outside the skeleton tissue and perform wide variety of function. Now let's see what are these functions. First of all, the calcium is used for the development of bones and tissue. Bones and teeth. We all know in our home, our mama will say, it always saying like, if you drink the milk, your bone will become strong. So this is the function, development of bone and teeth. Second one is for the muscle contraction. This calcium help in muscles contraction. This calcium ion interact with troponin C to trigger muscle contraction. Okay, and this calcium, it also activates ATPase, which increase interaction between myosin and actin. Okay, the next function of calcium in nerve impulse, in nerve transmission. Calcium is necessary for the transmission of nerve impulse. nerve impulse. Okay. The next function of calcium in our body is it is used in blood coagulation. Several reaction of cascade of blood clotting process dependent on calcium. Means in our body blood clotting is a one process in which most of the factors are dependent on the calcium. That's how it help in blood clotting. Next function of this calcium is membrane integrity and permeability. I think you all know this one. Calcium influence the membrane structure and transport of water and several ions across it. Means it help in transport of water and several ions. Okay. Next function of calcium is the sixth one, activation of enzyme. Means calcium is required, is needed for the direct activation of enzyme like lipase. Example is lipase, ATPase, succinate dehydrogenase. These all enzymes require calcium for its direct activation. The next function of calcium is release of hormone. There are certain hormones which require calcium for its releasing. The hormones like insulin, PTH, parathyroid hormone. Next, calcitonin. These all hormones require calcium for their releasing. Next function of calcium is eighth one, action on heart. This calcium act on myocardium and prolongs systole. Okay, these are the some function of calcium. Let's take a quick review. Function: development of bone and teeth, muscles contraction, next nerve impulse, blood coagulation, membrane integrity, permeability, activation of enzymes, releasing of hormones, action of heart. There are many more examples are also present. A function of this calcium is present. These are few of them. Next is dietary requirement. An adult men and women require 800 mg per day. Okay, and the children, they require 0.8 to 1.2 gram per day, and infants, they require 300 to 500 mg per day. Pregnant ladies, means pregnant women, lactating women, and post menopause women, they require 1.5 gram per day. Okay, these are the dietary requirement. Next, sources you all know: milk and their product, milk and milk product like cheese, paneer, etc. And this calcium is also present in beans, some leafy vegetables, fish, cabbage, and in also it is present in egg yolk. These are the main sources of calcium. Now the next is disease. Before that, I want to tell plasma calcium means in just remember this, our plasma, or let's say serum calcium level is 9 to 11 mg per dl. If there is any disbalance or there is any abnormal level in the serum calcium level, will results to any disorder. So now let's start disorders of calcium. There are many disorders of calciums. The first main, we all know, our bone and teeth become weak. Okay. Now the next disorder of calcium is hypercalcemia. Now what is this hypercalcemia? Just now I told you, any abnormal level in serum calcium will result to any disorder. Same. Hypercalcemia means elevation in serum calcium will leads to hypercalcemia. And this hypercalcemia is also associated with hyperthyroidism. Okay. Now the symptoms of hypercalcemia: muscle weakness, loss of appetite, nausea, constipation, etc. In hypercalcemia, what happens is, I'll tell here, serum phosphate activity decreases and alkaline phosphatase activity increases. Now the next disorder of calcium is hypocalcemia. Hypercalcemia means increase in the plasma or serum calcium level. And hypocalcemia means decrease in serum calcium level. This hypocalcemia is more serious and life-threatening condition. In this, the serum calcium level decreased to 7 mg per dl, or less also. It decreased like 6 mg also. The symptoms of this. Okay, wait. First, this is also like hypercalcemia associated with the hyperparathyroidism. This hypocalcemia is also associated with hypoparathyroidism. And this may happen after an accidental surgical removal of parathyroid PTH, parathyroid hormone gland, or due to autoimmune disease. Okay, this hypocalcemia and this serum calcium level decreases. This is more serious and life-threatening condition. It is associated with the hypoparathyroidism. This is majorly happen when after the removal of PTH means parathyroid gland or due to autoimmune disease. Symptoms of hypocalcemia is neuromuscular irritability and convulsion or convulsion. Okay, the next disease of calcium is rickets. It is a disorder of defective calcification of bone, and this rickets is maybe due to low level of vitamin D in the body, or it is also due to deficiency of calcium or phosphorus, or both calcium or phosphorus. In this rickets, in ricket disease, the serum calcium and phosphorus may be low or normal. In this, activity of alkaline phosphatase is increases. Okay. The next disease is renal rickets. This renal rickets, it is associated with damage to renal tissue, causing impairment in the synthesis of calcitriol. Impairment in the synthesis of calcitriol. Okay. Next disease of calcium is osteoporosis. This osteoporosis is by demineralization of bone. This osteoporosis is by demineralization of bone. This will result in progressive loss of bone mass. This osteoporosis majorly occur in elderly people, means those people whose age is above 60 years. This can occur in both the male as well as female. It will occur in both. And this will result in frequent bone fractures. Okay. Now the next disease, this one is 6. The 7th disease is osteopetrosis. Osteopetrosis is by increased bone density, and this is also due to inability to reabsorb bone. This is also due to inability to resorb bone. Okay. These are the some disorders of calcium. So I think you know why this calcium is important for us. The calcium has a lot of function. That is why this is present in abundant. So that's all. This video is on calcium, mineral calcium. What are the function, sources, dietary requirement and disorder of the calcium. Thank you for watching my video.